Hello, everybody. This is Tanya, and I'm here to talk to you about Becca, the patient in our simulation, about pain management. I am a maternal child nurse, and so I have a good history of teaching patients about pain management after they are discharged. Although Becca does pose a challenge because of her vulnerable situation in her homeless status. I have a history of working at a Bon Secours facility, so I am aware of the need to work within the mission and the vision of Bon Secours. And in doing that, we should be addressing alleviating the pain and suffering that Becca is experiencing and focus on the wholeness of her care in the midst of her suffering so that we address her physical, mental, and her spiritual well being. We should also be teaching her within the accordances of the ethical and religious directives of the Catholic Health Ministries and providing Becca with teaching and instruction in a respectful and dignified manner. When developing a teaching program for Becca, I need to realize the importance of getting her input in that care so that I know what kind of resources she's going to have available to her. Anderson and McFarland stressed the importance of knowing what kind of community resources are going to be available to our homeless population. So will Becca be going to a shelter, and does the shelter have room for families? Will she be able to, be there with her newborn? At that facility, will there be a counselor to assist her? Will there be social workers? Will she have access to doctors or nurses should an emergency situation arise? I know in the simulation it mentions the fact that Becca had been on narcotics. And so that might be something that the doctor may be hesitant to give her, but we still need to address Becca's discomfort and treat her as a person. And some physicians may very well still provide Becca Percocet despite the fact that she was on some medications. We just need to provide her discharge instructions with a stress that she needs to only take the medication as directed. She should not take any other medication. She should only be taking things that are prescribed for her at this time, and she should not be mixing any alcohol or thing like that with the medications that are prescribed for her. Becca mentioned that Motrin makes her belly hurt, and we need to talk to her about the purposes of Motrin, but we also need to let her know the side effect of Motrin is stomach upset. And so to avoid that, she needs to be able to have something to eat. If she can't have something to eat right then have something to eat as close as possible to the time frame that she's taking the Motrin to try to avoid having stomach upset. Becca needs to know the purpose of her Motrin, that it is for pain, it's an anti-inflammatory, and can also be used for fever. She needs to know it could be pain associated to her breast, to cramping, and to perineal discomfort. Also, if she's given the Percocet prescription, she needs to know the side effects of the Percocet. She needs to know it can make her lightheaded, it can make her dizzy, she might itch, she might even have a rash, and she needs to know the safety precautions to take due to these side effects, especially while caring for a newborn. If she doesn't need to take the medications by mouth, maybe we can try something topical like an antiseptic spray. Or anesthetic spray, excuse me, that she could use something like Tux, like that has witch hazel in it to help soothe her bottom, especially if she has hemorrhoids or swelling associated to that perineal repair. She could also use ice or something like that to help with the soreness and the swelling to her perineal area. Ice could also be used for management of breast discomfort, and we need to talk to her about using a good supportive bra if she's not breastfeeding, and that if she wraps the ice and put it up underneath her armpits, that could kind of help with engorgement. We need to talk to her about when she takes her showers that the hot water should spray her towards the back and not the front so she doesn't have increased swelling to her breast. Also, things that she can do to help with pain management that doesn't require any type medications or anything is that watching the way her activities, decreasing how much activity she has, not standing for long periods of time, not climbing steps, not participating in strenuous activity, not sitting on hard surfaces, sitting on alternating her hip so that she's not sitting directly on her perineum, so that she won't increase the swelling and things of that nature would also be beneficial. We should encourage her to drink plenty of fluids so that she doesn't get a bladder infection that could increase her pain, and plenty of fluids, and having a well-balanced diet like apples and oatmeal so that she doesn't have problems with constipation. There's a lot of things that she can do to help with her pain management, but we need to get her engaged in that. We need to ask her what kind of medication resources she has in regards to Medicaid. Can she get the medications like the Motrin and the Percocet, even if we prescribe it? So we need to go ahead and make sure that we have the proper referrals in, and that she'll be able to get the proper follow-up care that she may need, and what she should do should pain arise despite all the things we have taught her. So in dealing with the readings and the things that I've been exposed to in regards to this simulation, I've learned that it's really important to assess my clients thoroughly in regards to their discharge needs, so that I can plan even more so ahead of time, so that I can provide them the most beneficial care and I can get the most quality results that I could possibly achieve with this population, and consider the limitations that they have in providing that care. Thank you.